Hey everyone, this is Jonathan Marx from Go to Health. I hope you are having a great day. It may be hard to believe, but this September we are celebrating the 25th anniversary of the attack on the World Trade Center on 9/11. Many Americans will reflect on where they were that day. However, for a generation who were too young to fully understand the full impact of the event, the story continues in a different way. Today, those children and teens are young adults, and some may now be experiencing chronic health conditions without realizing their symptoms could be linked to the 9/11 exposure. Many of these individuals may also be unaware that they could be eligible for no-cost care and medical monitoring through the World Trade Center Health Program, which is a federally funded program administered by the U.S. Centers for Disease Control and Prevention. The program is focused on reaching this often overlooked population and connecting them with the medical care and monitoring they may need. For many, the story of 9/11 did not end 25 years ago. It's only now beginning to surface in their mental and physical health. We're talking today with Dr. Leigh Wilson, Medical Director of the NYC Health and Hospitals WTC Health Program Clinical Center of Excellence. She'll be able to explain to us what this program is all about, who is covered, both first responders and population, and you'll learn a lot about the kind of help you can get. If you want to learn more, you can go to cdc.gov/WTC. That's for World Trade Center. cdc.gov/WTC. So welcome to the show, Dr. Leigh Wilson. How are you today?
I'm fine. Thank you so much for having me. I really appreciate the opportunity to speak to you today.
Good. So, we're about to recognize, and this is incredible, the 25th anniversary of September 11th, 2001, when the World Trade Center was attacked and collapsed. The collapse released a tremendous amount of toxins into the environment. Can you tell us how big is the geographic area in which people's health has been affected?
So it has been recognized over a significant area. The World Trade Center Health Program covers for the survivor population what is called the New York City disaster area, which is currently recognized as south of Houston, river to river in Lower Manhattan, and a 1.5-mile radius into Brooklyn from the WTC site.
Mm-hmm. Okay. And what are some of the chronic physical and mental health conditions that are potentially linked to 9/11 exposure, especially those surfacing in young adults now who were alive at the time of the disaster?
So some of the initial conditions that were covered through the World Trade Center Health Program in the early days, things you can imagine is directly related to dust exposure, such as asthma, sinusitis, rhinitis, so upper airway inflammation, GERD, which is like acid reflux. Also, they cover conditions called interstitial lung disease, sarcoidosis, a number of lung conditions. With the passing of the Zadroga Act that went into law in January of 2011, the government recognized that folks were exposed to known and probable human carcinogens in the dust. So a number of cancers were added at that time, and a number more were added later.
So what kind of cancers have we seen develop?
We see cancers that have come out as that we tend to see in the general population. There is some data coming out that there may be a link between dust cloud exposure and lung cancer, but at this time, the list of conditions covered by the government is on the CDC website.
Okay. And let me give that website while we're talking about it so people can go there. It's cdc.gov/WTC. And WTC, of course, stands for World Trade Center. cdc.gov/WTC. So what exactly does the World Trade Center Health Program cover, and how does it work to support those who are affected?
The program covers first responders as well as the survivor population. So the first responders, you can imagine NYPD, construction, folks that worked for Con Edison and that kind of thing, as well as FDNY. The survivors are the people that I currently take care of at the Health and Hospital site. And those are the people that were students at the time, local residents, local workers, attended daycare, adult daycare, and so on.
It's quite a broad population. Do we have any sense for how many people this is?
So the estimates are varied. For the responders, they estimate up to about 100,000 responders.
Wow.
They estimate up to about 400,000 people may be eligible as survivors.
Wow, that's huge. I would not have thought a number that huge. So how does somebody know if they can be eligible for the program and what steps should they take to enroll? Now, I understand there's no cost care and monitoring. Is that true?
So let me take those two questions separately. To determine if somebody is eligible, they should go to the website that you mentioned and look at the criteria, determine if they were in the New York City disaster area during the defined time period. And that would the survivors. The responders have different criteria as well. They have to have worked or volunteered on the rescue recovery effort. So that information is on the website. And then the no cost healthcare question. So again, the responders and survivors are different. Responders, if they're eligible for the program, are entitled to annual surveillance exams. And if they have a WTC certifiable condition, which is a condition that is related to their dust exposure and accepted by the government, their care will be covered at no cost to them for that certified condition. For survivors, similar but a little bit different. In order to stay in the survivor program, a patient or a member, as we call them as well, needs to have a certifiable condition.
Okay.
That would entitle them to the annual surveillance.
So, Leigh, you are the director of the NYC Health and Hospitals WTC Health Program Clinical Center for Excellence. What is this program? Tell us about it.
So the Clinical Centers of Excellence is a designation by NIOSH, the National Institute of Occupational Safety and Health. They're the folks under CDC that administer our programs. So our program was started by Dr. Joan Rye out of the Bellevue Asthma Clinic many years ago when she recognized that there was definitely a need and an uptick in patients showing up with severe asthma that she linked to exposure, WT dust exposure. Mm-hmm. So the clinical centers each take care of different patients, and we're on contracts with the government, take care of 9/11 survivors in our case and first responders in other cases.
And who funds this program? Is it the federal government?
So there's a DROGA bill that went through Congress and was signed into law January 2nd, 2011, funds the different clinics.
Got it. Okay, good. So Leigh, are there any questions I didn't ask that I should have, or what kind of big message would you like to leave with people today?
So I would encourage the folks that may qualify as survivors to look at the CDC website, call the helpline if you have questions, and see if you are eligible. A lot of the folks that qualify as survivors may not realize that we're here or not understand what the program is about. Please, at this anniversary, take a look, see if you are eligible. And if you have a qualifying condition, we would love to see you.
Good. So again, that website is cdc.gov/WTC. And again, you're eligible for this program if you were a first responder at the time, and also if you were alive at the time in this New York City area that the doctor described. If you're having health symptoms, please contact the program, see if you're eligible for support. Leigh, thanks so much for being with us today. It's amazing that this is 25 years later and we're still dealing with this, but thank you so much for running this program and being available to us.
Thank you for having me.
Good. This has been Jonathan Marx with Go to Health. Remember, you can visit our website where you can see over 300 evidence-based interviews at gotohealthmedia.com. You can watch us on YouTube, listen to us on 8 podcast networks, and we're all over social media. And if you like what we're doing, please give us a thumbs up or a 5-star review. That helps us get the word out to more people. Thanks so much for being with us. This has been Jonathan Marx with Go to Health. And as we say at the end of every show, go to health. God bless. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.